Okay, we're live.
Hi, welcome to Alvernia Live Chat. We are now live across Instagram, Facebook and TikTok. My name is Dr. Allen Sim. I'm a senior consultant urologist practicing here at Allen Sim Urology at Mount Alvernia Hospital. I'm really glad you have taken time out during lunch today to join us on this in this conversation. Today we'll be talking mainly about prostate cancer, which is one of the most common cancers affecting men. I'll be sharing more about the risk factors, signs and symptoms of prostate cancer, screening options, treatment approaches, and what is life like after a diagnosis of prostate cancer. So please feel free to leave your questions in the chat. I'll do my best to answer as many of them as possible during this session. So a bit of an introduction about myself. I'm a urologist, but my subspecialty interest is mainly on minimally invasive surgery, particularly robotic surgery. Something that's quite unique about my practice is that I actually practice both in Singapore and in Malaysia. So in Singapore, my clinic is located at Medical Center A, Level 302. Prostate cancer, as I mentioned, it is very, very common in male. It is the risk increases as you age. Some of the important risk factors about prostate cancer is mainly about the age of the patient. The older you are, the higher the risk of getting prostate cancer. I always tell my patient, if you are at 60 years of age, your risk of getting prostate cancer is about 60%. And if you're 70 years of age, your risk is about 70%. Of course, there are other things that increases the risk, such as obesity, smoking, and the one very, very important factor is family history. So if you have your siblings, your father, your uncle with prostate cancer, then your risk of prostate cancer increases. And if you have more than one relative with prostate cancer, then the risk definitely increases exponentially. So I think we will, in the interest of time, we will move on to the first question. So the first question is, I hear about prostate enlargement affecting older men. Is prostate cancer also mainly an old man disease, or can younger men get it too? So the answer is that prostate enlargement and prostate cancer is common in elderly patients. So the risk of getting either one of these increases with age. Having prostate enlargement or BPH doesn't increase the risk of you getting prostate cancer. However, the risk of both of these diseases increases with age. So can younger men get it? Yes, of course you can. That really depends on your own factors, such as if you have a strong family history and if you have multiple family members with prostate cancer, then your risk definitely increases. So I do have patients with very strong family history, and we actually advise them to go for screening at a much younger age. Okay, so let's move on to the next question. Okay, so this is the next question. So at what age should I start screening for prostate cancer? So for most patients, when I mean most patients, means you don't have any strong risk factors, you don't have strong family history, it is advisable to start screening for prostate cancer at the age of 50. But however, if you do have strong risk factors, strong family history, then it is advisable to start screening as early as the age of 40 years old. So a lot of it really depends on your own personal medical condition, and as well as your personal risk factors as well. If nobody in my family has prostate cancer, am I still at risk? Yes, of course. Having someone with prostate cancer in your family definitely increases your own risk. But even if you have no one, you can always be the first one in your family that gets prostate cancer. So again, it is to do with age, and the reason, one of the common questions that patient always ask me is, what is the reason why elderly men get prostate cancer? The answer is really quite straightforward. It is because of your own sex hormone, which is your testosterone. So the older you are, the longer the time your own prostate gland is exposed to the sex hormone, and with that, there's a chance for the prostate cells to undergo mutation and eventually become prostate cancer. So age is really one of the major factors in prostate cancer. Okay, so the next question, my father was told he has an enlarged prostate years ago. Should our family be more concerned about prostate cancer now? So as I mentioned, prostate enlargement or BPH doesn't really put you at risk of prostate cancer, but as I mentioned before, both of these diseases are very common as you age. So I think most of the patients, elderly patients, they will have some element of prostate enlargement, but that doesn't mean that they can or cannot have prostate cancer. So either way, regular check with your urologist is important. Screening PSA is very, very important as well to detect prostate cancer. So the next question, which is from Facebook. Hi Dr. Sim, my dad is in remission now. Is there a possibility that it will come back? I presume the question is your dad is under remission from prostate cancer. So, okay, to answer that, I would think that I probably need to know a little bit more about the stage of your dad's diseases, because the whether it's in remission depends on what stage was he diagnosed, what age was he diagnosed, and what sort of treatment options was given to him. So it really depends on what is your dad's condition. Maybe you can submit more information and we can help answer that more accurately. Alright, so let's move on to the next question. This is from TikTok. Okay. Okay, so my dad always says if it doesn't hurt, it's not serious. Is prostate cancer usually painful in the early stages? So yeah, so what your dad says is actually something that I hear very, very commonly. Most of the patients will actually ask, why do we need to go for checkup when they are usually not having any pain? And usually, even though some of the men that come for follow-up or for checkup, they came because of urinary symptoms, and the urinary symptoms is actually most of the time not due to prostate cancer. It is actually due to the enlargement of the prostate, causing the patient to feel that the flow is slow. They need to strain to pass urine. So the symptoms are usually due to enlargement of prostate. So most early stages prostate cancer doesn't have any symptoms at all. The so-called one of the symptoms that we normally see is actually the increased level of prostate-specific antigen, also known as PSA. So that's one of the very, very important message that I always tell my patients and my patients' family, that screening PSA is very, very important. So of course, if you are in a late stage of prostate cancer, for example, stage 3, stage 4, where the cancer has really spread all over the place to the bones, then you might start to feel some symptoms such as lethargy. You might even feel bone pains, but that's usually very, very late stage. So that's something that we don't want to see. We hope to pick the patient up early at stage 1 and stage 4 and hopefully offer them a treatment and a chance for cure. So we have some questions related to PSA. So my uncle's PSA came back at 4. Is that high, and what number would you recommend further investigations? So we are worried about him. So it is okay. So to answer that question, so the level of PSA, there's no real hard and fast rule about what is considered normal and what's considered abnormal. Of course, if you look at the lab, usually they will use the cutoff as 4, but that is not, like I said, it is not strictly speaking that we must use the level 4. If you have higher than 4, you're definitely prostate cancer, and if you're less than 4, then you definitely do not have prostate cancer. So this is just a reference range that we use. The exact level that is considered normal for you really depends on your age, the size of your prostate, and also your family history. And another very important thing that we do when you come for checkup is actually digital rectal examination, meaning we put a finger into anus and to feel the surface of the prostate. So that test alone is very, very important, because I've seen multiple patients before the PSA is completely normal, but when we do a digital rectal examination, we actually feel a hard lump on the prostate. So for this sort of patients, we will proceed to investigate even though the PSA is normal. Increasingly, we don't just rely on PSA. For example, if you do have strong family history, even though your PSA is borderline and you are slightly on the younger age, we do suggest the patient to go for MRI prostate as well. Just to share, I have plenty of patients before the PSA level is normal, but the MRI prostate actually does pick up stage 1 or stage 2 prostate cancer. So that's one of the other tools that we use to hopefully detect the disease earlier. Okay, so okay, so the next questions, can heavy drinking cause enlarged prostate? Well, I'm not saying that heavy drinking is good, but there's no direct relation between alcohol consumption to the prostate enlargement or even the risk of prostate cancer. But however, we do know that alcohol consumption is not good for your general well-being, not good for your health. That as much as possible, we should avoid that altogether. So another question from IG. When would be the appropriate time to do PSA test if my husband is not in the recommended age range? So, as I mentioned before, it's recommended to do the screening from the age of 50. But if, like I said, if you do have family history of prostate cancer, then it is advisable to start as early as the age of 40. So the matter, it's a question of whether how early do you want to do the screening. Like I said, the 50 is just for your own reference. If you're worried, particularly worried about prostate cancer, it's more than fine to start screening at the age of 40. Okay, so feel free to leave any questions about prostate cancer in the chat, then I'll do my best to answer them. So in case you're just joining now, so we are doing the live chat on prostate cancer. So if you have any questions on prostate cancer, feel free to submit here, and I'll do my best to answer them. So this is from TikTok. I'm a husband. How do I check for early symptoms of? Oh, sorry. I think this is not. Well, if you are talking about early symptoms of prostate cancer, as I mentioned before, there is not much of symptoms. The only reliable thing that we can do is actually to do a screening blood test, which is PSA. So again, that's something that we can that we always emphasize to patient as well as the family. So this is from IG. My father has been in remission for prostate cancer for 4 years. What steps can be taken to reduce the risk of recurrence? So I would say if your father has been in remission for prostate cancer for 4 years, then more than likely that he has been diagnosed as stage 1 or stage 2. Then usually, again, that really depends. I would like to know more about the grade of the disease, what is the exact stage that he was diagnosed with, to help us give a better prognosis for him. But in terms of what steps he can do to reduce the risk of recurrence, of course, number one, he needs to continue his follow-up with his urologist, do regular PSA screening. And usually we don't require any sort of scans for prostate cancer follow-up. So PSA is more than enough. And of course, the other aspects such as maintaining good health, maintaining a normal, good regular diet and normal weight, I think all of these factors will definitely help in keeping the prostate cancer in remission. Of course, if it's a smoker, I always advise the patient to quit smoking altogether. Okay, so this is from Facebook. My dad was diagnosed with stage 1 and did radiotherapy. It's been 3 years now. What is the possibility of it to come back? So again, yes, even though it's just stage 1, but it is also good to know what grade of prostate cancer is he, because we do know that prostate cancer comes with a Gleason score of 6, 7, 8, 9 or 10, so it's important to know what Gleason score your dad was diagnosed with, what was the PSA level, and if it was an MRI scan done, what exact stage was he. So I presume if stage 1 radiotherapy and it's 3 years and your dad is well, then the prognosis is generally good. I would say we do not have the exact information, but the 10-year survival is usually upwards of 80 to 90% if it's a truly stage 1 low risk prostate cancer. Okay, so we'll move on to the next question from TikTok. So, is it a myth that you can mitigate prostate cancer if the male has a healthy sex life? I think that's a very, very commonly asked questions. And I think maybe a couple of years ago there was a newspaper article about the frequency of ejaculation relating to the risk of prostate cancer. So I think when the article came out, then I get quite a lot of questions on this issue as well, whether if you ejaculate more then you have a lower risk of prostate cancer. So actually this has been researched extensively. I'm not sure how they researched it, but it was researched extensively. There is actually no direct relation between frequency of ejaculation to the risk of prostate cancer. So that has been debunked. Yeah. So when would be appropriate to do PSA test if I think we've answered this as well. Whether the patient is not in the recommended age range, like I said, 50 years of age, that's the best. If you are worried, you can always do a bit earlier at the age of 40. So this is from IG. My dad is going for a screening. What happens during a prostate examination? So most of the time for patients that come for prostate cancer screening, usually we'll ask the patient some questionnaire about their urinary symptoms. So we usually give them what we call International Prostate Symptom Score. This is more to know whether there's anything that is bothering them in terms of their urine flow. That's more related to the prostate enlargement. Then we usually do a urine test to see if there's any signs of infection in the urine, and the most important is the screening blood test, which is the prostate-specific antigen (PSA). And when the patient comes in for consultation, of course, I will get the history from the patient about the underlying medical condition, whether there's any strong family history of prostate cancer, their occupation, social history, whether the patient is a smoker, and then I will look at the PSA, the urine test results, and we will usually also get the patient to do a uroflow test. That's to see whether the flow of the patient is actually affected. And the last thing is that we will do a digital rectal examination, as I mentioned before, whereby I will stick the finger into the anus using lubricant, of course, and to feel the surface of the prostate, and also gives us some idea about the size of the prostate. Most of the time we will also do a bedside ultrasound that gives us a bit more information about the size of the prostate and whether it's causing any obstruction, whether the bladder of the patient is full. So these are the things that we will do. Yeah, so that is that's a good question from TikTok. So why check the digital rectal examination if we have PSA and MRI? So that's a very good question actually. So for us, for most urologists anyway, we can't just rely on the PSA level as well as MRI. I mean, if we subject everyone that comes in for checkup to MRI, I think that will really increase the cost of a health screening. So that's not advisable. So MRI is not a health screening tool. So what is most reliable and most cost effective is still the history taking, the PSA level, and the digital rectal examination. So like I mentioned before, I have had many patients with a normal PSA level, but the digital rectal examination is actually abnormal. And if they went through MRI, subsequently biopsy proven prostate cancer. So that is actually something that is very, very important that we still do not skip, even though we have the tools such as PSA and MRI prostate. Okay, that's another question from TikTok. So what are the ways for men to reduce the risk of having prostate cancer? Well, generally speaking, like I said, the risk increases with age. So, I mean, I get asked that quite frequently. So I always tell them, I mean, half jokingly, but unless you can reverse aging, then you can definitely reduce your risk of prostate cancer. So there is no good way, definite way to reduce the risk of prostate cancer. As you grow older, the risk increases with age. But of course, what you could do is that you could maintain a healthy lifestyle, maintain a good weight, normal diet, and definitely avoid things like heavy alcohol consumption as well as smoking altogether, because these are the things that can definitely increase your risk of prostate cancer. So next question from IG. Hi doctor, my father is a 61 years old man having frequent urination but no obvious pain. When should we be concerned about prostate problem, and what symptoms will make it urgent for a checkup? So yeah, that's also something that we get asked quite a lot. So as I mentioned, if you are talking about prostate cancer, most early stage prostate cancer doesn't have any symptoms at all. The urinary symptoms that most men experience are usually due to prostate enlargement. That's due to BPH, also known as benign prostatic hyperplasia. So that is a separate question altogether. So if they have frequent urination and no obvious pain, yes, then they most likely they do have prostate problem. Of course, it could also be a bladder issue, but if the frequency is bad enough that it affects their lifestyle, affects their sleep. Some patients even have too bad a frequency that the urine leaks out on their own. So if that's bad enough, it bothers your father enough, then definitely they should come for a checkup. So move on to the next question. Okay, so is there any food that is good for prostate health? Okay, that's also a very, very common questions that we get asked in terms of food, in terms of supplements, what is actually good. So prostate, particularly prostate cancer, is one organ that is very, very well researched. So there is actually plenty of research on about the role of supplements such as saw palmetto, whether is it helpful, does it help to prevent prostate cancer. In terms of food, the common things that we always get told that is helpful for prostate cancer prevention is like pumpkin seed, tomato, all of these things. Actually, the research has been done. None of these supplements or food actually lowers your risk of prostate cancer. It does help a little bit with your urinary symptoms, especially if you do have prostate enlargement. But in terms of prostate cancer, it doesn't lower the risk of prostate cancer. So next question from Facebook. I heard that prostate cancer is slow and not lethal, sometimes better not to treat. Yeah, so trust me, this is one of the common thing that a lot of patients, especially the family, or not so much the family, the patient themselves will say that prostate cancer is very, very slow growing and they are not so aggressive, and sometimes it's better not to know and then better not to treat them. So I think to a certain extent, if you talk about medically speaking, yes, prostate cancer in general, they are slow growing, they are less aggressive compared to, for example, liver cancer, lung cancer, or colon cancer. However, we cannot, this is this is what we call overgeneralization. So you can't say that everyone's prostate cancer is the same, everyone's prostate cancer is not aggressive. So we still do recommend early screening, early detection. As to whether you need treatment or not, I think that's a discussion that you should have with your urologist, because I have plenty of patients with very, very early, low-risk prostate cancer that they decide not to do anything because they want to preserve their urinary function, they want to preserve their sexual function, and they only opt to treat the disease at a later stage. So I think that's a very, very good and viable option. However, like I said, you have to discuss with your urologist, because you need to be put on what we call active surveillance protocol, and we need to observe the disease, and we will intervene as long as you see that a sign that the disease is actually progressing or getting worse. Okay, so my dad can't control, this is from TikTok, my dad can't control his bladder and often wet himself with no feeling of going to the washroom. So I think that that sounds very, very serious. Whether is this due to prostate cancer? Most likely not, unless we are talking about late stage prostate cancer where it's causing him not to be able to pass urine at all. It's causing what we call overflow incontinence, where the bladder is just too full and some of the urine just leaks out. But most of the time, these symptoms is most likely due to BPH and prostate enlargement, and that is the one that is resulting in these symptoms. So yes, so it's most likely due to BPH, but we still need to come for checkup to make sure that there's no underlying prostate cancer as well. So we have just 5 minutes left to our time today. I think we've answered plenty of questions. Thanks for being so forthcoming with all your questions. So I can take 1 or 2 more questions, so feel free to leave any comments or any questions so that we can address them. So okay, 1 more question from IG. My dad is healthy, exercises regularly and have no medical conditions. Can someone like him still get prostate cancer? Okay, so the answer is definitely yes. So prostate cancer can happen to anyone, doesn't have any warning. Of course, like I said, if you have family history, then yes, you do have a higher risk of prostate cancer. But other than that, if you don't have any family history, it can happen to anyone, and it's usually silent. It's one of the silent killer for men. So again, you need to do early prostate cancer screening using the blood test, which is the screening PSA. So from TikTok, okay, so yeah, so I think one of the viewer is asking for symptoms, signs and symptoms of prostate cancer. So just to recap, prostate cancer, most of the time, early stages prostate cancer has no symptoms whatsoever. The patient can carry on living their life as per normal. A lot of the symptoms that they experience, such as the urine problem, they feel that they need to strain a lot to pass urine, the flow is very weak. That is most of the time due to enlargement of prostate. But however, if you have stage 3 or stage 4 prostate cancer, where prostate cancer has spread to other organs, such as the most common place that is spread to is usually the bone, then you can have bony pain. They might even get a fracture of their bones. So that is if they are in late stage of prostate cancer. So one more question from IG. My friend's dad is in their 60s and never gone for prostate screening. Is it too late to start? Well, better late than never. So that's what I tell patients. Of course, we advise family and patient to start at the age of 50 if you don't have any family history. But if you're just coming to know about prostate cancer, the importance of screening, is never too late. So you can always come in for consultation. You can always do your screening PSA and do your screening digital rectal examination. So it's never too late. Okay, so I think that's the last question. So thank you very much for being so forthcoming with all your questions, and thanks for joining us today. I had a lot of fun answering all the questions. In case you have missed any segment, in case you join a bit later, we'll also share some of the cut downs of the video on our social media. And of course, if you have any questions, and some of these questions you might be embarrassed to ask during this live session, feel free to drop by my clinic, and we can always do a in-person consultation or even a teleconsultation. So you can follow us on our socials, Facebook, Instagram and TikTok, to stay informed of all the upcoming sessions. Thank you. See you again.